How often do dental implants fail?
So dental implants overall, there is a failure rate of maybe 5 to 10% across the board for single implants, for prosthetic implants, everything like that. With Nuvia, it's less than 1%. So implant success rate is over 99%.
And why do you think there is such a low failure rate with Nuvia?
I think it goes back to the materials and the technology that we're using. So kind of going back in the history lessons of the All-on-X in the 90s, this flexes. And so if you're allowed to heal without movement, you're going to have less complications.
And you said you've worked with both processes. So can you maybe talk about what you saw working with this like traditional dental implant method? Like, were you having to repair a lot or?
How much time do you have? Because it's going to take forever to talk about this prosthetic. This prosthetic is great. It was great when the technology and the techniques were designed in the late 90s. But in my opinion, this is a disservice for all patients these days because we've had a huge boom in technology in dentistry.
So how long are these things supposed to last anyways?
I mean, I think the goal obviously is to make sure that these can last the rest of your life. But it's very important that you comply with the oral hygiene, keeping things super clean, and just using common sense. So sometimes patients have weird habits, maybe chewing on utensils or fingernails. We had some fishermen, they bite on the fishing line, and stuff like that. You just have to kind of manage your behaviors as well and baby this as much as possible. That way it can last forever.
So again, you've done both of these processes. From your perspective, what do you think the biggest benefit is for doing it the 24-hour way?
I mean, that's a huge question. And the only answer that comes to mind is it's patient focused for me. So when I used to do this prosthetic, teeth in a day prosthetic, it was great. It was good. Patients get their teeth immediately. But now they're in these kind of temporary phase for 6-10 months. And so there's that transition period for 6 to 8 to 10 months where they're in these teeth. And so it can be a little bit fatiguing for the patient. And then by the time they get their final teeth, it's a happy moment, but the patient's been through so much that it's a little bit muted. I think with Nuvia, what I've definitely noticed is when we're able to reveal their smile 24 hours after surgery, and these are their final teeth, their final smile, it's just life-changing. You can tell their personalities completely change. They may have come in to consult very quiet, kind of a wallflower. But once you get them into their permanent teeth, they're smiling, they're laughing, they're able to socialize more and just allow their personality to come out. And we just have these amazing patients that come in and they're just super quiet. And then they get their teeth and they're just amazing individuals that have a lot to say, love smiling, giving hugs to everybody at every appointment. So that's the difference. So you're not getting that delayed response in terms of being able to smile.
Well, Dr. Park, it seems like this process is not too good to be true.
It's definitely not. I think it's misunderstood just because there's a lot of misinformation online and people just don't understand that Nuvia is taking all the advanced technology possible and continuing to take advanced technology and putting it into their systems and always trying to change it and make it so that we can provide, the best treatment for our patients.
My last question is everyone a candidate for this?
Unfortunately not. I wish everybody was, but it's very important that you take that first step, take that 60-second quiz to see maybe if you could be a candidate. And then don't be afraid. Come in to consult, meet the doctors, meet the team. We'll take a scan and we'll just talk to you and tell you what your journey looks like. And if we're not able to provide this prosthetic for you, we'll definitely give you information on what your journey may look like and maybe direct you to a provider that can provide you with, some kind of treatment.